So now let me share with you guys the unit. So now we are doing cash level 2 health and social care. So this is unit 2, handling information in the care setting. So can you tell me anything about the information, how you handle it in the care setting? Do you have any idea about how to handle information?
Keep it in the safe place.
Yes, excellent.
Have like that any information that you record, if you can't put it in a safe place, if it's not like a paper based, that you can make sure that it's got a safe, secure password or a PIN or something like that.
That's an excellent point. Yes. So to handle that information, we need most important thing is to store it and store it well, because the information we have, it's not our data, is data for lots of people we care for. So these information should be stored well with using maybe a password. If we have this information on the computer, we should, if we have files, we should lock the cupboard where we keep it in. This information as well needs to be up to date at all times. Because let us say one of the clients that you have, God forbidden, something happened to him, you need to inform his parents, his family, his wife, whatever his age group is, his kids maybe. Let us say he's suddenly gone to his hospital, or she gone to hospital. You need to inform their families at all times.
They all have. Oh, sorry. And I was going to say, to cut you. They all have to be like dated and signed also. Like they all have to have the date on it, and they have to be signed. So they know it's accurate. So they know it's on this day, it happened on this day.
Absolutely. Yes, very good. So each one of our clients will have his own file, and this file will have their own information, all signed by them. Any update needs to be put in that file and also stored in the computer. And also, if we don't need this information anymore, let us say this client has moved to another care home or moved to another city, or so it's not our responsibility anymore. Should we keep his details for a very long time? We shouldn't. No. We keep it for 1 week while we need it. If we don't need it, then we shouldn't keep their information. Yeah?
Yes.
And also, we shouldn't pass their information to anyone else.
Yes.
Do you remember how we can pass their information? First of all, it should be on the need to know base.
Yes.
So you don't pass everything, you just pass the information needed, and also you need a consent from the person himself or herself. And if this person has got no mental capacity, then we get the confirmation from their family. Is this clear?
Yes.
Yes.
Excellent. So now if we go to answer the questions, health and social care level 2, that's as we said, unit 2, handle information in care setting. So first question is identify the legislation that relates to the recording, storage and sharing of information in the care setting. So can you remember or think of any legislation relates to recording or storing the information, or even sharing the information? So if I go to the book 1.1, we have it here, identify the legislation that refers to the recording, storage and sharing of the information in care setting. If I scroll down, all the legislations are there. So first of all is Data Protection Act 1998. This act is really important. it's the core of our work, because it tells exactly how to handle the information. That the information we keep is very sensitive, that we should take care of this information. We shouldn't pass it to people without the people's to other people without the person consent, and also should be up to date, and we shouldn't keep the data for a very long time, as long as we don't need these data. So if I read for you here what this legislation has, this act is the main piece of. Can you read my notes, or the book notes, or is it too small? Is it good enough? Can you read it, or do you want me to enlarge the screen?
Yeah.
You can read it? Excellent. So now, Data Protection Act. What you can do for answering this question, I would just put the legislations one by one, exact names, word for word. You don't change the name for the legislation, but you can put little bit of description about each legislation, okay?
Okay, so number one, so the question number one, you said we can't take this information as like it is, we can't change anything.
Just the name of the legislation. So
data.
Yes, this is exact word for it, because this is legislation, like for everyone. It's not plagiarism if you put Data Protection Act 1998, because this is the name of the legislation. However, you see all this description here?
Yes.
You can just rewrite it in your own way. Just make it small, short, straight to the point. Just like I explained to you now. So first, you need to put all the legislation, which is Data Protection Act 1998.
Okay.
General Data Protection Regulation 2018, Human Rights Act 1998, and Freedom of Information Act 2000.
Okay. So each one
yeah,
we can take one example?
It's not an example. You need to tell us just a small description about what is it all about. So we still have Care Act 2014, Health and Social Care Act 2008. Yeah, so you need to put all this legislation as it is, and also describe them a little bit to show that you understand this legislation, because later on you will be working in a care home or in a hospital caring for people. You need to understand these legislations. Exactly, not just to mention them, you need to understand them. So first of all, we have Data Protection Act 1998. This act is the main piece of legislation that protects the right of people who have personal information recorded. So it is all about, under this act, all the information you use in the care setting must be. These are important points. You need to write in your own way. So under this act, the information we collect must be, first of all, collected and used or processed fairly. So first of all, the information need to be collected and used fairly. What does this mean? We shouldn't what? We should have person permission to collect this information. We shouldn't just record any information about this person in his file. We need to collect them fairly, yeah? So, and lawfully. So the person knows exactly, or she or he knows exactly what kind of information is being collected about them and how it's being collected. So when they sign, they know exactly, they can check their data, they know what kind of information we have collected about them. Also, used and held for a reason. So we don't collect everything. We collect specific information that we need for our work. And also accordance, accurate and kept up to date. So always the information should be kept up to date. Very important. And remove when necessary. So as I told you, if you don't need this information anymore, you just remove it from the system, just in case this person has moved to another city or another care home, then you don't need their information. So you don't need to store it. Yeah?
Lana?
Yes?
Are we, you see what we're doing now, yeah? What we're talking about now? Are we doing the reflective account, or are we going through the unit now?
This is the unit. This is question 1.
Oh, okay. Oh, you're
Yeah.
going through this, you're not going through the reflective account.
No, it's the reflective account is just underneath it. So first we will start with
The question.
Yeah, with
All
the
right.
questions, and we go later on the reflective.
Lana, sorry,
yes,
are we going to do it at bullet points? We should do it like bullet points like that on the book.
That would be great. Yes.
Okay.
Yeah, just something simple. I don't want because it's a legislation. You need to understand it. You don't need to write lots of chapters about it, but you need to understand it, because later on you will use them in the workplace. So they are very, very important to your work. Okay, and now we need to keep them up to date. We need to remove them from the system when it is necessary. So if this client has moved to somewhere else or to another care home, then we don't need their information anymore. And also this information need to be collected and used in line with the person's right. For example, can do this by informing individual what information is being collected about them and for which reason. So, as we said, first legislation we put down is Data Protection Act 1998. Why do we have this act? We have this act to
information
regarding all the information we use in the care setting. Excellent. And why? First of all, just to tell us how to use the data in the workplace. So first of all, we collect this data and process it fairly and lawfully. We don't go to unlawful ways to collect this data, and also we use them and held these information for a reason. For example, we can only do this by making sure that the information is requested for an individual care plan. So we take this information for a reason, which is being requested by the care plan. So we have for every client a specific care plan. Let us say Mr. X. Mr. X has got diabetes, so the care would be totally different from Mrs. Y, and Mrs. Y has got heart attack sometimes, and sometimes
blood pressure.
Yeah, blood pressure, high blood pressure, or even she is so
take medicine,
different from so every care plan is totally different. So this means we hold this information according to the person care plan, and also this information should be adequate and should be relevant, not excessive. What that means you don't get loads and lots of information about the person. You just need something relevant to you, to him. So you, for example, this Mr. X, which we just talked about, he's got diabetes, so we can get the information. When did he get the diabetes? Was it when he was very young, or was it now? Which type of diabetes? How, like, does he take tablets only, or does he need injections?
Injection.
Or yeah, exactly. So you need relevant information to this person, not excessive, which means not too many,
Just
too
to
much information.
understand the
His
person.
situation. Excellent. Yeah, this is the point. And also need to be accurate and up to date. There is no point having wrong information about the person. Like even now, as in the college, to be honest, we have lots of information about each person, each one of you. There is no point me having a wrong phone number and wrong email for each one of you, because how can I contact you later on? So we need the information to be up to date at all time and accurate. And remove this when it is necessary. For example, this person is no longer receiving care from this care home, then we don't need to keep their data. And also, when we collect this information, we need a consent from that person that we collecting this information about them. Is this understood about the Data Protection Act?
Yep.
Yeah, you don't need to write like.
Just take something like you need it.
Absolutely. So you see here what you have 1, 2, 3, 4.
Yeah, I
5,
think you
6.
can't type just 2 lines from all of them.
No, not 2 line. You need all these, like, but
Yes,
how you
like
do it? Yeah, Data Protection Act 1998. If I was going to answer this question, I would say that under this data, all the information we collect in the care home need to be, number one, collected to use for and processed fairly. Number two, the information need to be held for a reason, which is the care plan of the person, and also need to be accurate and relevant, not excessive. We don't hold lots of information about the person which we don't need. And also the information need to be accurate at all times and up to date. We don't keep wrong information about the people, and also we remove them from the system as soon as we don't need them. Let us say this person has moved on and left this care home, so we don't need their information anymore. And also when we collect information, we have the person consent. So if you write this, that's it. Then you have answered the question. You don't need to put all this, but just bullet points to show
just
that you understand.
a small sentence. Yeah, each one.
Yeah.
Absolutely, that's really good. So second legislation, which is General Data Protection Regulation 2018. What is it all about? It's about keeping the data safe and secure. For example, you can do this by ensuring all paper-based and electronic information is assessed by only those who have permission to use them. And also stored well in a locked cupboard or in a password. Yeah?
Yeah.
And also verified before transfer it to others. So we need to understand why the information needed by others, then we can give them the information. We don't give them everything. So this legislation is all about organizing the information. Individual will have the right to give or and to withdraw their consent at any time, and also the right. So here is all about the right of the people, and also individual right and interest must be safeguarded, and all public authorities must have a named data protection officer. So in each care home, they should have a named data protection officer to be responsible for this information. So here, this legislation is not too far off the first one we checked. This is called General Data Protection Regulation 2018. This is what it is all about. First of all, the information should be kept safe. So if we have paper-based information, we should lock in a cupboard And if we have it on computer, we should have password, like Candy said.
Yeah.
And also you should verify before you transfer the information, why the people want this information. And also we should organize the information properly. And each one of the person has got the right to give us or to withdraw his consent at any time, because we can't collect this information without the people consent, correct? Person in the care has got the right to either give us the consent or maybe withdraw it. And all public authorities must have named data protection officer. What does this mean? Means in each care setting, they need to have a person who's responsible as a data protection officer, responsible about the information inside the organization. Why? Because let us say one of the care home, they do collecting a lot more information they need, and also without people consent. So who's gonna get the blame? No one. That's why the government wants certain person to be responsible in front of the government if something like this happened. So every care home needs to have a named protection officer for the data protection officer. Is this understood so far? Yeah?
Yeah.
Okay, excellent. Now we have a Human Rights Act, Rights Act 1998. So human rights. What's the human right in terms of data? Because the Human Rights Act is very long, but in terms of information, what we have here, we have Article 8, the right to respect for your private and family life. So the right of the person to be respected for his private life. And number 2, this article states that personal information about an individual must be kept securely, not shared without permission. And also personal information about the person includes, for example, official record, letters, diaries. So personal information could be anything. So this is just to declare what's the personal information. So the personal information could be anything, could be his letters, his diary, his medical record, all this considered as personal information. And also you should be aware of these rights, because in your role you will gather lots of information about the people. So when you come to describe, you put here as an answer, part of the answer, you put the Human Rights Act 1998, and then you say everyone has got the right to have a private life, private information. And also you put the personal information should be always kept securely. And you put as well personal information about the person could be anything, could be his letters, his diary, his medical records, everything considered as personal information. And also you shouldn't discuss or gather any personal information without knowing the rights of the people and also get consent from them. So is this understood?
Yes.
Okay. Now we have a Freedom of Information Act 2000. Freedom of information. So we said we can't share people's information, but here is something totally different, which is the Freedom of Information Act. So how this will work with other acts? It says under this act, as a care worker, you must support individual right to access and view information that has been recorded about them. So here it's freedom of the person himself or herself. They have the right to access their own information. Let us say your client, Mr. X, he's suddenly not satisfied that he's got a problem with his family, and he's not satisfied that they are accessing lots of information about him. For example, he will come and ask you, I want to access my information. And that this act, which is the Freedom of Information Act, you should allow him to do so. So you should show him what's the information is being kept about him and why. You tell him why as well. So the information of the Freedom of Information Act 2000, it's all about support individual right to access their own information. And also you should remember this when you're recording information about individual, that they will have access to this information. You should remember that the act does not allow people to access the personal data of other people. Okay, so when you say freedom of information, you should always remember that you always support others when they want to access their own information. However, you don't allow others to access someone's information without that person's consent. Is this okay? Understood?
Yeah.
Yes.
Excellent. Now we have CARE Act 2014. CARE Act. So under this act, where is it? Provide the information and advice for individuals need to make a good decision about their care support. So under this act, we give the people the information they need. Like, for example, Mr. X, we give him all the information he needs to know why we have put this specific care plan for them and why we're supporting them this way. So we need to give them all the information they need to understand their situation so they can make their decision about their care support. Also, provide information and advice for individual in a way that we can understand, for example, by making it available in different formats. So not all the information could be understood. Some of them, like jargons, for example, the doctor will have lots of information about this person given to you. You think lots of words they can't even read or understand. So you can't really tell this person about what the doctor has put in his file, because lots of information are too hard for him to understand. So you need to make it accessible. You need to make it understood to that person. If it was in a different language, let us say this Mr. X, he's from another country. He doesn't speak only Urdu, or he doesn't speak only Swahili or any language. Then we need someone to translate this to him, because it's not fair that we have all this information but we don't share it with him. So we have someone to translate for him. So under the CARE Act 2014, first of all, we provide the information and advice for individuals to allow them to make good decisions about their own care. Yes? So first of all, we provide them with all the information so they can create a good decision about their care, and also provide information and advice for individual in a way that they can understand it. Is this okay? Understood?
Yes.
So far? All right. Now we have the last legislation, which is good. Health and Social Care Act 2008. Regulated Activities Regulation 2014. So you just need to write it all as it is. Health and Social Care Act 2008 Regulated Activities Regulation 2014. What is it all about? This act is all about use personal information about individuals in a care setting in line with your organization requirements so that care provided to individual is safe, effective, and high quality. So first of all, the way we use the information, we follow the policy and procedure. That's very, very important. So when we use personal information, we need to follow the policy and procedure so that the care for the people is effective. Number 2 is promote openness and supporting individual and others to raise any concerns and complaint they may have. So we should be open with the people and we should be supporting the individual if they want to make any complaint. And also promote transparency. What does it mean, transparency? Do we know? Transparency. Have you seen in Word when
Is
you say
organization?
Yeah. So, well, yes, it is about the organization. So when you say transparency, have you seen any item where it says it's transparent? The glass is transparent. Why? Because you can see through. Yeah. So transparency is it's not. It's opposite to barrier. Transparency is mean they can that we are open to them. They can see through. They can understand. So it's very important. So the organization need to be transparent with the individuals and their families. So I don't put barriers. I don't start. Have you seen in the exam, for example, everyone tried to write his notes on his sheet without letting others to see their papers? Yeah. This is other way around. So we write about other people, but we show them if they need to. Transparency is mean we are open. We can share this information with them. We are allowing them to see what we have information about them. So if you need to answer this, the last one, which is Health and Social Care Act 2018, you can write, use the personal information in the care setting in line with their with the organization policy or procedure. So when we use the information about individual, it needs to be in line with the policy and procedure. And second thing, we need to promote openness and support individual when they have any concerns. We can help them to make complaints if they want to, and also we need to be transparent so the people can understand what we're doing and why we're doing it. Is this okay so far?
Yeah.
Okay, excellent. So this is to answer question
number one.
Yes. So you just need to put all the legislations one by one. And under each legislation, just put bullet points about what is it all about. Just put the small bullet points for each one of them, just to show that you understand. And it's good to have these. Why? Because when you graduate, you will be able to go back, look at your notes, and know which legislation meant what. Yeah. Now, Number 1.2. Explain why it is important to have a secure system in place for recording and storing information in the care setting. This is my second question. So why it is important? Why do you think it's important? So if we don't have secure system, what will happen?
Everyone can see.
Absolutely. That's the main point of having secure system. Because everyone can access that information. Let us say I have all my almost lots of information about the clients in paper base. I put it in a cupboard, but this cupboard is not locked. Everyone can access it. That's really bad for the clients because their information is shared by anyone wants to have it. And it's bad for you as an organization because you are allowing other people to do so. So that's really the main point. So explain why it is important to have secure system in a place to recording and storing the information. So the individuals that you care for also need to be confident in you. They need to know that their information will not be shared with other people without their consent. Also, their information should be recorded safely and securely, so no one will have access to it. And this will show that the client that we care about their information. We are compassionate. We care about the information we have. Keep it private. And if you're not recording and storing the information properly, the information that we have about others in the setting may need to access about individual will be of poor quality. So all the information we have is of poor quality because anyone can access it. We need to have the secure system to keep it safe and to keep it high quality information. Yeah. Yes. If the information is not accurate or correct, then there are mistakes, then we can't even use these information. They are unusable. So that's why we need them to be correct at all times. Yeah. So as you have learned, it is important to have secure system in place for recording and storing the information in the care setting to comply with the legislation. So first of all, we need to comply with the legislation. We have so many legislation. If we don't comply with the legislation, then there is massive problem for our nursing home. So we need to first of all, we keep secure system because we need to comply with the legislation. Not doing this will mean that you are not carrying out your responsibilities properly. So first of all, we need to follow, we need to have secure system because we need to follow all the legislation in the country about data and information. And we need to comply with these legislation. If we don't do it, we don't do our responsibilities properly. And also, these information need to be correct, accurate. If we don't have the accurate information, it has poor quality. If anyone can access it, it's a poor quality information. If we have any mistakes, if they are not up to date, they are poor quality. So the individual that they need to have confidence in us. If we don't store the information properly, they wouldn't respect what we're doing. They wouldn't have confidence in us. They might leave the center where they are now. So we need to show that we care about the information. We care and we have big compassion about handling their own personal information. It is also important that individual in your care home setting understand that you will only share this information they have given you if you have their permission. So it's important to tell, like when you take any information from the person, you say, Mr. X, I'm collecting your information now, but we are not sharing this information with anyone without your consent. You need to tell them that. It's very important to keep them satisfied, to make sure they have all the confidence in the center. It's very important. So they are not worried about their information anymore. And when you make a decision about what information can be shared and not shared on the need-to-know basis, the individual person situation must always be taken into account, as well as their best interest. So when you share the information, you need to share it on the base of need to know, and also regarding the best interest of the people. So if passing the information is not good for this person, let us say he has a problem with his family, and his family want to know, to have lots of information about him, maybe to sue him in the court, or so I know it's need to know base, but it's not having the best person interest at heart if you pass this information to these people. So you shouldn't pass this information. Is this understood so far?
Yes.
Yes.
Okay, excellent. And also it is important that individual understand that sometimes you have to share information about them without their permission. So when you told the client that I'm not going to share your information without your permission, sometimes you need to share it without the permission. Let us say he fainted and you call the ambulance. You can't just stand still while the ambulance man there. You need to tell them more about his situation, how many illness he has, or why he fainted right now, or something happened before that. Any information needed. So you need to tell your client while you're collecting the information. You say, Mr. X, I am collecting this information. I'm not going to pass it without your consent. However, sometimes I would need to pass it without even your consent if it is in your best interest. Yeah?
Yes.
Okay. So, for example, if the individual tells you that they are going to harm themselves, so this is another way, like suddenly you hear your client saying, oh, I want to commit suicide. I'm going to do it in the night. I'm going to do this. You can't just stand still and not share the information, because he might harm himself for real. And then what you would do? You will be the one who will be blamed for this, because you already knew that and you didn't pass this information. So sometimes, even without the person consent, you still should share the information, because it's in the person best interest that you keep him alive.
Yes.
Because not doing that mean that they will put themselves and others in danger, something that you cannot allow to happen. Okay, so now let's look at where we are. Why it is important to have system, we just talked about it. Now describe how to access guidance information and advice about handling information. So we need to know how to access information about, what is it? So which question is that? 2.1. Let us go and look for 2.1. Describe how to access guidance, information, and advice about handling the information. So can you think about ways to access the information, just like what we done in Unit 1? Can you think about ways to get more information about how to handle the data? Yeah. Can you think about how you get information? It is just described in this paragraph. Yeah. So first of all, can you tell me any way to get more information?
Information about the individual. You can ask the family members or the next of kin, your manager, supervisor, for information.
No, it's how to access information about how to handle the data. So how to handle the data at work. For example, I got lots of data from the family, as you said, from the client themselves, from my colleagues. I put all the data on the computer about this person. Now, how can I handle these data?
To make that, you need to make sure it's got a safe, secure password, like. And if it's, for example, if you're gonna send off that work, so if you're gonna collect all that work and then you're gonna send it to someone, you need to make sure that it's sent like in like a secure, like in a secure system, in a like, do you know what I mean? Basically.
Excellent. Well done. Thank you so much. So how do you know how to, you see here? Sources and guidance for information and advice about handling the information. So this is what we are looking for. Describe how to assess guidance, how to access guidance, information, advice about handling the information. So where we get guidance about how to handle the information. Who's gonna guide me? Let us say I started to be, I moved to be a manager in a care home. Yeah? Or just started as a carer in the care home. How to handle the data, I don't know. So where how to learn how to handle the data?
Your colleague or your manager?
Perfect.
Yes.
First of all, your colleague who's been in the business for much longer. Your manager.
Or, yes. Your manager, your senior manager, or you can access something called the ICO, which is the Information Commissioner's Office, and they could provide like information to help you with that.
Excellent. So first of all, we can get the information from the people in your work setting, your manager, your supervisor, others in the home, more senior position than you are there, or been in the business for much longer. Second thing, you can access it from
the internet, maybe.
From the internet, yes, very good. I don't have it here, but yes, you can access the information from the internet about how to handle the data. Also from training.
Yes.
This may take place in your work setting. On your employer may arrange for you to go and get training to handle the data. Also, you can get this from an external organization, like Candice said, other professional organization in the UK, government bodies, they all can, commissioners, officers, and public services website, for example, from a local authority, you can get the information about how to handle the data. And also you would know how to handle the data from the workplace documents. So if you go to any workplace, they will have certain guidance about, okay, you press now on this, you click here, you do this. So how to handle the data, you can get it from a document you might find in a workplace. Also, the policy and procedure will tell you exactly how to handle the information, how they handle it. Do they have it in a cupboards only? Do they have it online? Do they have it all online? There is no paper-based. Everything you can find in the policy and procedure, which is available in the work setting, specific guidance in the place. There are guidelines in the place about how we handle the data, and also there are policy and procedure which you should follow about the data. So now if I'm answering this question, which is describe how to access guidance, information and advice about handling the information. To answer, I would say I can access the guidance from the people in work setting, from my manager, from my supervisor, also from the more senior position, people in more senior position than I am. I can also get guidance through training. This may be taking part in my employer's setting, or maybe my manager will arrange for me to go outside in another organization to get this training through external organization. And also I can get guidance through external organizations, guidance and advice from professional organizations in the UK, Government Information Commissioner, as your colleague said, and also office and public services websites, for example, the local authority. I can also get information from my workplace documents, such as policy and procedure. They always have information about how to handle everything in the workplace, and also from specific guidelines in the place. Is this understood?
Yes.
Okay, excellent. So now if I go to 2.1, okay, we finished only this one left before we go to the reflective account. Now explain what action to take when there are concerns over the, why they are all mixed up. Okay, you can. No, my computer is not working properly today. So explain why the action, what action to take when there are concerns over the recording, storing, and sharing of the information. Let us say you're working in a nursing home or a hospital, but you're concerned that the people just sharing the information with everyone, or one of the people there that is just sharing the information with lots of people, talking, laughing in the corridors about one of the clients, and they are discussing his information in a funny way or something like this. So any concerns that you might have, what action would you take? So now if I go to I'm just looking for the number first, which is here. 2.1 says assessing guidance information. Now this we've done. Yeah, it's here. 2.2, explain what action to take when there are concerns over recording, storing, and sharing information. So now let us go back to our example, that people are standing in a corridor, like your colleagues, two of your colleagues, they are talking about one of the clients, and they are discussing his or her personal information and start laughing about it, or which is very inappropriate. So what would you do if you have any concerns? Don't you go and report it?
Wait, sorry, what did you say?
Okay. No, I'm saying if you have any concerns about sharing the information, if someone is sharing the information more than what it should be, or if people are having a laugh about one of their clients' information and they are just discussing it in front of
Go to your
other
manager
people.
first and report it.
Very, very good.
And that you
Excellent.
can explain to them in private.
Yes.
If not, then you could go to your senior manager. You could do it through writing, or you could verbally talk to them in private.
So this is really good. Thank you so much. That's really, really good. So the concerns, because in the question you have three, where is it? When your concerns over the recording, storing, and sharing. So that's the third one. So each one of these has different concerns. So the concerns, recording of information, you may be unsure about the correct form to use or about how much information to include. This happens, like you go in the workplace in the first days, and they give you some files to fill for some of the clients. You are unsure because you don't know how much information you need, how much information is good enough for this. You may have noticed that one of your colleagues has recorded inaccurate information about the individual. An individual advocate may raise concern over this information. Also about storing. So storing, they give you another example. You may have concerns over the filing system used for individual personal information, because you may be experiencing difficulties in retrieving information quickly. So you may not know how to find individual personal information so fast. So you need another system basically. And also about sharing the information. So this is all giving you some examples. But if you have these concerns, what would you do? To answer this question, you need to know what you do exactly. Like Candice said, report your concerns to your manager. So if I'm going to answer this question, I would say if I have any concerns over recording or sharing or storing information, I would have to report my concerns to the manager, ensure that they explain to me my concerns fully, and that you do not you do so in a private area to ensure that you maintain confidentiality of the information, because it's very, very important. You can't start talking about the person's data in front of others. So you need in a confidential area. And if you do not think that your concerns have been addressed, so first of all, you share your concerns with your manager. Where is it? So the action, step by step. Here, first of all, always record your concerns, and that the information that you have been reported to you immediately, so that you do not forget the important details. So let us say I have problem with the database, something doesn't save, and now we are losing lots of data. First thing I need to do before I go and tell my manager, I need to record it, because I might forget some of the details. So step by step, first of all, I need to record my concerns and the information that has been reported, and also so I do not forget them, the important details. And now you must include only the facts. You don't need to write more than facts, true records, what happened exactly. Remember to sign and date this record. Then second thing, you need to report your concern to your manager. Ensure you explain your concerns fully so that they do you do it in a private area to ensure to maintain confidentiality of the information. If you do not think your concerns has been addressed, then report them to someone more senior in the organization. And this could be in writing, because you've spoken to your manager, but she didn't really. She's not really concerned about that. Then who's higher in the organization? Let us say is the head of the organization, is the director, for example. Then you need to write to them, because you can't have access to that person. Then you put it in writing. So if something will happen, you say, look, I sent this to the director already. I have a copy of it. So you need to put it in writing, have copy of it. Now, after you do this, your work setting will have a concerns form that you will be required to use, so you should be familiar yourself with it. If the concerns has still not been addressed, then you can seek advice from other organizations. So first of all, what I did, I record my concerns in a form, and I signed it, put a date on it, so I don't forget the details. Then I passed my concerns to my manager and asked him to take action. But I discussed it with him or her in a confidential area. And then if the manager didn't do, they don't do anything about it, then you need to pass them to someone higher in the organization, such as the director. So I put it in writing and send it to the director, and also keep a copy of that to myself. Then what happened if the director hasn't done anything about it? If your concerns still has not been addressed, then you can seek advice from other organizations outside of your care setting, include the Information Commission Officer, ICO, and the independent charity public concerns of work that provides the free confidential advice to people who are not sure whether or how to raise concerns about practices in their own area. You could also report it to the Care Quality Commission, CQC, which regulates adult care, regulate the adult care setting. So report the concerns is very important because and follow it up through, because if something happened, no one can blame you. You already reported it, you already followed it through. So to answer this question, which is explain what action to take when there are concerns over recording, storing, and sharing information, I would answer it this way. I would say my action will be step by step. First of all, I need to record my concerns and the information that I need to report it immediately, because in this way I wouldn't forget the important details. And then I must include also any facts. I wouldn't put lots of details. I need only facts and detailed fact to remember, and also I need to sign and date this sheet. I need after that to take my consent to my manager, ensure that he explained to me my concerns fully. And this should be in a private area so I can ensure that the information is still confidential. And if I think my manager hasn't followed it up to answer my concerns, then I go to someone who's much more senior and higher position in the organization, such as the director, but I need to put it in writing. After that, if the director hasn't acknowledged my my concerns, then I need to seek advice from other organizations outside the care setting, such as Information Commissioner Office, ICO, and also independent charity public concerns at work. They provide free information about free confidential advice about how people should do against according to any concerns they have in the workplace. And also I can report it to Care Quality Commission, which is CQC, which regulates adult care setting. Is this understood?
Yes.
Perfect.
Yes.
Excellent. That's really good. Now let us go to reflective account. Whenever you see the red, whenever you see reflective account, it's all about me. Like each one of you has to talk about herself. Don't talk about the organization in general. So now, first of all, 3.1, keep record that are up to date, complete, accurate, and legible. So how you would keep records? It's all about you now. So if I go to 3.1, sorry, let us
I
go
said,
to,
yeah. So I said, yeah. Well,
yeah.
I will tell you a little bit about what I said. I said, basically, when I record information about my client, which is paper based, I lock them away in a cabinet with a lock, which needs a key to be open to gain access.
Okay, very good. That's a really good point.
I also said I date and signed all information I record about my client.
Yes, well done. That's very good.
Yeah.
Anyone else would like to add?
You could put them in a folder.
Yes.
Yeah, I don't know. Is that it? Is there more? I'm not sure. There might be some that I'm missing.
Yeah, that's good. But if we can put more there, that would be good. So let us go back.
Making sure that the care plan is up to date.
Very good. Very good. That's a very good point.
I'm just guessing. Okay.
No, that's really good.
Okay.
But you need to say I do.
Yeah.
I
know.
Perfect. So first of all, as Candy said, in the work, so let us read the question again. Keep records that are up to date, complete, accurate, and legible. So when I keep the record, when I I always keep the record in the workplace up to date, just in case we need it for emergency. So we know how to handle, how to get what we need accurately and fast. And just give examples. Just say, if my client has got suddenly heart attack, then I need to, when I speak to the ambulance service person, I need to tell him all the information. If I don't have this recorded properly and accurately, that would be a problem. So I need to make sure all the information are correct, are up to date, and handled properly. And also, so you see here, keeping record up to date. This is important because individual needs and preferences are changed as well. It's not only about emergency, but their preferences, needs are changing. So if someone like Mr. X again, if he suddenly start not liking coffee, he start want just tea. If we keep giving him coffee, that would make him irritated, because he told you a million times before he doesn't want coffee in the morning. So you need to keep up-to-date records for this reason as well, because people's needs, preferences can change. Then I need to keep up-to-date records about my client at all times. And also, as we said here, we need to provide true information to support them if there is any emergencies, if their life are relying on us. For example, is my client having a seizure or anything, and then I call the ambulance. I need to know exactly what's good for them. All the information needs to be up to date and recorded properly. And keep a record that are complete. So at the workplace, I always keep information complete and up to date, because if I keep half of the information not complete, that would be a problem. So always make sure the information are complete. Why? It is important because not doing this can mean that the important information about my client, for example, we are missing the important information. For example, individual health condition may not be recorded. So I missed that Mr. X has got, he just joined us. And his son told me that he's got diabetes, but I missed that. I didn't record it. So the information is not complete. That would affect his health, because we wouldn't know how to deal with him. We might give him sugar in his tea if he asks for, because we don't know. So it's very, very important. And then how to handle his medication is very important. So the information recorded need to be complete. And also when I write the information about my client, make sure they are accurate. So it gives accurate picture about what is really happening. Not not doing so, this will mean my decisions about the client, or the organization decisions about the client, could be made inaccurately, based on inaccurate information, which is really bad. For example, recording that you feel the individual was looking a bit down. So, for example, I can put this example about myself. If I was recording that my client is feeling down that day and not feeling happy, if I'm not recording this, then the night shift will come, and without him knowing that the client having a bad day, he will be maybe making jokes with him, or maybe start telling him something funny. The client is really upset and sad for something happened to his family. So all the information need to be accurately recorded. However, recording this individual told you that he was feeling a bit down when you are supporting him to get dressed in the morning is fact. And would therefore lead to further action being taken. This might include asking the individual to find out the reason. So when we talk to the client and they say, oh, I'm really sad today, I'm down, we need to get all the information. We can't just write down that the client is feeling down today. I need to get all the information I need to write about my client. So I ask him why you are sad, why you're down. Is it something happened in your family? Is it something relates to your health? Are you sad because of something you remembered from the past? I need to put all the information I need to take it from the client and write it down. And also regarding ensuring records are legible. So this means the individual, your colleagues and other accessing your records must be able to record your, to read your handwriting and understand it. Your writing. So when you write, you need to write carefully so they read it, understand it, and follow it through. If you write something not very clear, they might start wondering what is that, and then maybe put in their heads totally different thing, like to the same sentence. And then they might treat the client totally different way because there is a misunderstanding. Arrays. So in that case, we need to be accurate. We need to have, we need to write slowly so our handwriting is readable by every one of my colleagues. How would you feel if you access a record is not, you can't read it, then you start guessing what's there, and this would lead to misunderstanding. So if I was going to answer this question about myself, how to keep records that are up to date, complete, accurate, and legible. So what I would say, I would just like here they put keep record up to date. So what they did was they divided them: complete, accurate. Oh, this is bad color because it's not showing the writing. And then legible. So for me as a carer, now I'm just answering the question because it's in a red area. It's a reflective account, so I have to talk about myself. I say keep record. As a care worker, I always try to keep records up to date in the workplace. Why? Because if I need this for any emergencies, if my colleague would need the information for any emergencies, we will always be able to provide accurate information about that person. Otherwise, it would be a problem if we provide untrue information or not up to date or incorrect about his health, because his life or their lives would be on the online, like will suffer. So we need to be accurate in terms of the not. And also, if my documents are not dated and or not up to date, So the information recorded would not be usable. So we have to have them all up to date at all time. Also, as part of my job, I keep my the records complete, because there is always no what you say, there is no benefit of having incomplete information about the individual, because it's unusable. So it's and could lead to worst result. So I always make sure that I have all the information needed, and if I don't know which information needed, I can always ask my manager, but I always have to have complete information, so I don't put my client at risk. Also, in terms of writing accurate record, always I make sure I enter accurate details to the system, because could be very dangerous if the information is inaccurate about someone's health, about someone's illnesses, his habits. It's always important that I record the accurate information. Also for my client, because their taste is different from time to time. They might start not eating something or not liking something. If I don't put accurate record about them, then the customer would not be satisfied. Also, my records needs to be legible, which means I always, when I write the client's report, I make sure my handwriting is clear, readable, and everyone can read my handwriting. If not, then it would be a problem, because there will be a misunderstanding and the client will suffer. So I make sure I always write it carefully and slowly when I write my client report. So this is how you answer this question. Is it understood?
Yes.
Excellent. Okay, that's it. So we have just just now this final question says, following agreed ways of working, record information. So say again. So now we are just in the last question. It says, follow agreed ways of working for record information. What's the agreed ways of working? Do we know?
To be professional. Oh.
Yes.
Oh no, sorry, I'm reading it wrong. I didn't even read the question. Sorry.
No, just this one. What is the agreed ways of working for any organization?
Keep them safe and secure. So lock them away, put them in a safe place. Oh no, recording information. So making sure that they're accurate, they're up to date, they're signed.
Yeah, that's good. But when I say agreed ways of working, it's mean policy and procedure.
Yes.
Just in case that awarding body will call you and say, what's the agreed ways of policy?
You write all the information.
Yeah, so if anyone asks you what is the agreed ways of working in the workplace, you say it's the policy and procedure. Yeah?
Yes.
So now, following the policy and procedure, what is the, first of all, how to record information? Just for you, how do you record your information? So I start talking about myself. So if we go here, 3.2. Okay, follow the agreed ways of working. What is how to record information? So first, I can't talk about myself, as we said, because it's in the red area. It's about reflective account. So now I start saying, when I I always at workplace, I follow the policy and procedure correctly. So when I record the information, I always make sure that there are different type of information, and these information. Sorry, just 1 second. Let me put my plug because my computer is not charging now. Yeah, so when I record this information, I always make sure that the information recorded are all accurate. Yeah? And they all up to date, day by day. When the information has been recorded, and I make sure that the information I record about my client, that they are recorded for a reason. Also, all the information I record should be always correct. Is this understood?
Yes.
Yeah.
So this is the first
Yeah.
part where it says, if you follow the policy and procedure, how would you record the information? Just I say to follow. I always in the workplace, I follow the policy and procedure in terms of recording data. I make sure that the data I record is always up to date, because it is my responsibility. They all the data are complete and also kept up to date. I also need to make sure that these information recorded for a reason. I don't record any information. I record it for a reason. Also, when I record the information, I use the correct process, and all the information are accurate at all time. So I use the correct process. Let us say in the workplace, they don't have paper-based, you just keep it on computer. So you just follow the policy and procedure. So at workplace, I always make sure that the information I recorded is under the correct process. Okay? So I'm just really changing these bullet points. I'm not, yeah?
Yes.
Now, when you get to second part where it says follow the agreed ways of working when storing the information. So when storing the information, I just answer this. In my workplace, I follow the policy and procedure when storing information. I always know where about all the papers, paper-based, and if they're electronic, how they store them. So before that, I need to take a training, so I know all these, and I do it exactly like what the organization would want. Also, you can say, I always use a correct method to store this information, and I also keep these information secure. I don't give the password to people. I don't give the keys to anyone. I just use it and give it to my manager when they give it to me. I don't pass it to others. That's why we should to keep the information always correct. Stored properly, I mean. So to answer this, for you in the workplace, how you store information, what would you say? They're all here. The ones I just said are all here. So what would you say to store the information in the workplace? Come on, guys. I've been talking now for hours. So for you, how What would you do to record information?
To keep the paperwork in a safe place.
Is that about storing or recording?
Storing.
Okay, about storing. Just you need to talk about yourself because this is reflective account. You reflect on your work. Yeah. So just say in the workplace.
I need to keep my paperwork safe.
Excellent.
And I need to keep it in a like safe place and the computer safe as well.
Okay, very good. How would you keep it safe? Can you think about ways to keep it safe?
I can do access to my computer. So I give a password and to keep it safe.
Yeah, I don't give other people access to
I
the
don't give, yes, I
password.
don't give to other people to access their accounts.
I'll follow the
Yes.
procedure of the company that I work with, and I will store information on the computer, but make sure that the computer have a password. And if it's paper-based, I'll make sure that the cupboard have a key, and I will return back the key only to the manager, and I will not give information to people that it's not necessary to give it to.
That's perfect. Both of you have said it correctly. Well done. So to store the information, for me as a person who works in care, I always make sure I store the information securely because it's my responsibility. So if the information is paper-based, I make sure to put it in the right cupboard and lock the keys after I use it and give it back to my manager. And if the information is recorded on computer based electronically, then when I use the password, I make sure I don't give this password to anyone because the information is my responsibility. Also,
if I want to share the information.
Yes, yeah. So about sharing the information, how would you do to share the information?
I want just to make sure the information I share it with others is they understand the reason why I'm sharing this information.
Okay, good.
The only way I will share information is by asking the individual for their consent.
Yeah.
Or if it's on a need to know basis, like if the person is in danger, I would have to share it with the police. I would only do it on a need to know basis. I wouldn't share all of the person information. Only that will protect the person from harm. That's the only
Okay, excellent. So,
and then we can do as well, show them before I share the information.
Yeah.
Show the person the details when I want to like sharing the information. They make sure I'm sharing, they know I'm sharing the information.
Okay, excellent. So, to answer the last part of the question, which is sharing the information, I say in the care setting, part of my responsibility is to keep this information safe and secure. So when I share the information, I don't share it only on the base of need to know. And also, I always make sure I have the person consent before I share it. And also, I wouldn't share this information without me knowing the reason why they need this information. Otherwise, I would pass everything. I should always ask what they exactly needed. Then I can and understand the reason why they need this information before I share it.
Yes.
And I need the consent from the person. If I don't have the person consent, then I need his family consent just in case he's got mental issues. Then I can have his family consent. If I don't have any consent, then I might have to go back to my manager and ask for advice, because it's not down to me to share others' information without any consent. And you need always to check, to make check before you share these information as to why they need the information, what information they need. And with all this, I follow the policy and procedure of my workplace before I share any documents or any information about the people. So far, are we happy with that?
Yeah.
Yes.
So this is everything. This is your coursework for today.
Okay.
Would you like? Yeah, you see, it's very short. It's very simple, but you need to write a bit more than what you put last time, because I have level 3. They are really writing like books. So what we need, we don't need to get this much, but you write a good amount, you answer the question properly and write a good explanation to show that you understand. Otherwise, the wording body think you might not understand it. That's why you put 1-2 lines and that's it. You need to put more. You need to show understanding, answer the question properly. Now, do you want me to go through any of the questions again?
No, but Lana, you said the unit 1 said briefly explain, but this one didn't say briefly. That's why I did more than 1 and 2 lines for some of them, but some of them have like 2 lines because it said briefly explain. But at the end of the day, I do understand what you're saying.
Yeah, absolutely. Now, for unit 1 was good.
Yeah.
All of you submitted. The work is great.
Thank you.
Yeah, well done. So for Ghana unit 1, you passed it. So now all the consent is unit 2. You have the book. The book is answering everything bit by bit.
Yeah, thank you.
So yeah, please. So read the book again. I'm going to hopefully send you this recorded if I can. As I said to you, I'm going to send a link on YouTube.
Yeah. Don't send a link. I don't think you can send a video. It's hard to send video using email. So if you send a link, I will go to YouTube.
Absolutely, yeah. That's the only worry. Last time I couldn't send anything because